Dr. Ed Shahady, and we're here at the Cardiometabolic Risk Summit in Las Vegas, and I'm here with Ms. Marty Funnell, who's one of, to me, in my mind, one of the premier diabetes educators in the country, has done a lot in that area. Marty, one of the things I know that you've written about and you talked about is, words like compliance and adherence might be dysfunctional. Do you want to explain more about that?
Sure. So I have three issues really with those words. The first one is that compliance doesn't really have a good definition. We don't know what it means if you are compliant or not compliant. If you look at the studies, and many have been done on medications and lifestyle change, the variation in what's considered compliant goes between 60 and 100%. So by telling me that someone's not compliant, I don't know if that means you missed your pill once in 3 weeks or you haven't taken it but once in 3 weeks. So it doesn't have much meaning for me. The other issue is that it doesn't tell me how to help the patient. What I really want to know is why. And I want to know about the decisions that the patient is making and why they're making those choices and what happens when they make those choices, either way. So in order to work with the patient, I have to understand their thinking and their decision-making process, and just hearing that they're not compliant doesn't help me to do that.
Why do clinicians like to use that word? Is it so I can blame somebody other than myself?
Well, that was my third reason. So you led me right to it. I think it's a way for us to, in some ways, distance ourselves. It's a way for us to perhaps absolve ourselves of some feelings of failure. We want to be successful. We're driven people as health professionals. And so while we're very quick to take credit for our patients that do well, I brought that patient's A1C down to 7.
Yes.
We're less likely to say, I kept that patient's A1C up at 10. We just don't do that. It's easier to say that patient is not compliant. So I think we need to pay attention to the issues related as to what our patients are actually doing. I think it's more helpful to think of it in terms of why and how can I help.
How do I get at the why?
You ask. And our patients are pretty smart people. Most adults are pretty wise in terms of their own behavior. And so questions that I like to ask are things like, what gets in your way? What happens when you make that decision? What goes into that choice? Whether it's medications or diet or exercise or whatever it is. And I also like to have them think about what would help you to be more faithful. And is it a schedule issue? Is it a importance issue? Is it an information issue? How can I help you to better figure that out?
Well, thank you very much, Marty. That's very good information.
Thank you.
Thank you.